Can everyone see my screen? Okay,
Yes, Doc.
so I entitled this talk Black Swans and Long COVID. And what might you ask, do black swans have to do with long COVID? And it really has nothing to do with the origins of the COVID virus. That came from a market in Wuhan, China. But a black swan event is an event that comes as a surprise, has a major impact, and when you look back, it should have been predictable. For example, a 1,000-year flood happens very rarely, but has a major impact, and we can fairly well predict these will occur. The attack on 9/11, as you look back, it should have been predictable, perhaps not that specific event, but the fact that an airplane could be used as a bomb rather than hijacking passengers. I don't know if you remember the Deepwater Horizon oil platform disaster in the Gulf of Mexico in 2010. That was totally predictable. A valve jammed on the oil well, and there should have been procedures in place to control the leak of oil, but there weren't. So in these events, the impact is so extreme that risk managers classify these events separately to avoid being lulled into a false sense of security. And my premise is that long COVID can be classified as a black swan event. In actual fact, pandemics like COVID have been predicted by experts for at least the last 10 years. And we should have been better prepared to deal with COVID when it did appear. So what is long COVID? I'm not talking about the acute disease where you're sick for 10, 14 days and then you recover. Long COVID is defined by the World Health Organization as a COVID infection with symptoms that last for at least 2 months, and they can last for more than 18 months. And there are patients around the world who are still suffering from long COVID after 3 years. And the symptoms are often debilitating. They're perhaps not lethal. You're not going to die, but you might wish you were dead, if I can put it that way. And experts now agree that long COVID is not a single illness, but it's rather an umbrella class of diseases like cancer. There is no single cancer. There are multiple different cancers. And we now think there are multiple different diseases that constitute long COVID. Last December, the US Census Bureau reported more than 36 million Americans with long COVID. That's about 10% of the population. And almost 1/3 of those 36 million had symptoms lasting more than 3 months. And some individual states reported almost half of all COVID patients had long COVID. And it includes people who can no longer work. This can be very debilitating. In the UK, there are about 2 million people reported with long COVID. And those numbers are expected to rise as we go into an endemic phase. So can you develop long COVID? In a Scottish study of 35,000 patients, more than half of the patients reported symptoms beyond 12 weeks. And a little over 10% still had symptoms after 18 months. And there have been multiple other studies showing the same kinds of results. So up to half of the patients who become infected can develop long COVID. Actually, the latest numbers are more like 25%. So 1 in 4 will develop long COVID. What are the symptoms? Well, symptoms occur in all major organs. You know, the heart, lungs, immune system, your GI tract, etc. And I'll come back to that in a moment about why this might happen. So the largest effects we see, though, are in the heart and lung and brain. There's a recent, very large study just been reported that shows that heart attacks in basically the whole population, aged 25 to more than 65 years old, heart attacks increase twofold compared to what you would normally expect in that population over a period of 12 to 18 months. And that's probably the result of inflammation of the heart muscle. One of the theories on why the virus causes long COVID is that it infects and damages cells throughout the body. and that damage lingers and then causes major effects, like heart attacks, like strokes in the brain, like pulmonary embolisms in the lung. Other milder but still serious symptoms include extreme fatigue and debilitating tremors. I read one story from a young woman in New York City who was in her mid to late 20s, was a long distance runner, developed COVID, and she couldn't climb a single flight of stairs for many, many months afterwards. Very debilitating. And then there's this so-called brain fog, the collection of symptoms affecting the brain that make you feel as if you're living in a haze. You can't focus, you move slowly, you think slowly. It's almost like you were drunk and lost, disoriented. People who have brain fog say the effects can be life-altering and devastating. It keeps them from many activities like driving. You can't drive your car because you can't focus. Biking, public speaking. Some have had to stop working entirely. And nearly all of them say they're forced to rely on a notebook to remember simple things as it's time to eat. You actually keep a diary that says at 12 o'clock, make yourself lunch. And word recall and short-term memory can be a great challenge. It can have a major impact on exercise. People with long COVID typically have lower endurance capacity. The story I just related about the young woman who was a long distance runner who can't climb a flight of stairs now. And the research is showing that it can add 10 years to your virtual life. It makes you act as if you were 10 to 15 years older than you really are in terms of exercise ability. So what is your risk? Lots of nasty symptoms. Let's go back to the black swan. Low risk, but major impact. And that's my theme here. So what is your risk? Well, if you've been infected previously, if you've had a COVID infection and you get a second infection, you actually have a higher risk of developing long COVID. So you should be taking precautions if, like me, you've suffered already from a COVID infection. Risk increases as your age increases. So, you know, I'm an old guy. I have a higher risk than some of the other people on this call. Women are more affected than men. We don't understand why, but it is more common in women. And pre-existing health conditions such as problems with the lungs or heart disease increase your risk. And chronic kidney disease and obesity are also risks. So I want to talk a little bit about perception versus reality. You know, people have stopped wearing masks. People in the US and many countries in Europe, they've abandoned protective measures such as mask wearing and social distancing, physical distancing. But the CDC surveys show that people's perception of the status of the COVID pandemic or epidemic bears little resemblance to reality. How many people can tell me what percentage of US counties today still have high transmission rates of COVID? The answer is more than 10%. So there are still pockets of very high transmission in the US. We're still seeing more than 200,000 new infections every week and more than 2,000 deaths every week. And for the third year in a row since 2020, COVID is now the third leading cause of death of Americans behind heart disease and cancer. So it's a lot less widespread than it used to be, but it has not disappeared and it won't disappear. If you're up to date in your vaccines, the risk of serious acute illness is minimal. The vaccines protect against serious disease and hospitalization. However, 84% of Americans, and I can't speak for other countries, I apologize, but I know it's a similar case in the UK. 84% of Americans are not current. They haven't had the latest vaccine shot, the bivalent shot. And again, I want to reiterate the importance of age. 93% of COVID deaths in the US up till now have been in people over age 50, and 90% of those are in people over age 65. If you were young in your 20s and you developed COVID, you're probably not going to have a serious problem. If you're my age, there's a much higher risk. The vaccines do not prevent infection and they do not prevent shedding. So you can become infected, you can pass on the virus. And the latest variants of COVID are what they call immune evasive. They can escape your immune system and infect you. And with the removal of the US public health emergency, and they've done the same thing in the UK, we're going to see more people being infected because the virus is still around. The CDC and the National Health Service are not paying attention to individual health and risk. Now they're looking at community health and risk. So yes, you've got a low risk of becoming seriously ill, but if you get infected, you, as I said, 25 to 50% chance of developing long COVID. Now that may resolve within 3 months, or it may go on for more than 18 months, but so how can you lower your risk? Well, the first way is don't get COVID. That's 100% effective. You don't get COVID, you won't get long COVID. And as I said, your vaccines are not 100% effective, but make sure your vaccines are up to date because they protect you against the acute disease. Carry a mask and wear it when in close contact with others. I have masks in my car. I often have a mask in my pocket. And if you don't feel comfortable, wear it. Avoid crowds if you can, or if you're in a crowd, certainly wear a mask. High filtration masks, so-called N95, KN95, or KF94, are one of the few measures that can reliably minimize your risk of infection. And those are available for $1 to $2 each on the internet. If anyone wants to know where to find them, I have a site that guarantees they're the real thing. They're not some knockoff from China, China. And they also protect you against other viruses like influenza and respiratory syncytial virus, which is on the rise, or is actually coming down now, but it's been on the rise. Surgical masks, the blue masks you see, are not nearly as effective as an N95. So the causes of long COVID, the answer is we don't know, but there are two leading theories. In the brain, our nerve cells are continually dying off and being removed by the immune system. They're being replaced, and the dead cells are being removed. In animal studies, we've shown that COVID infection can actually stimulate the immune cells that remove these dead neurons, and they begin to attack normal nerve endings. So the symptoms that you develop for COVID, long COVID, would depend on which part of the brain was attacked by these cells. So that's why there's such a variety of symptoms of long COVID. The other theory is that microclots, very tiny microscopic clots, will form in blood vessels. And I don't want to get too technical, but the virus has a preference for the cells that line blood vessels. A recent study found, I mentioned it, people 25 to 44 have a 30% increase of heart attacks. And the second study said there's actually a 90+% chance. The clots block delicate blood vessels throughout the body, stopping oxygen from getting to different parts of the body. That then allows tissue degeneration. And once again, the symptoms depend upon which part of the body was affected by the virus. So I want to come back to the black swan and talk about the risk is low. Your chances of becoming infected with COVID today are much less than it was 6 or 12 months ago. But if you do become infected, there is a significant risk that you can have a devastating, serious disease. So the black swan, low risk, high impact. And currently, there is no known treatment for long COVID. It is treated like traumatic brain injury that you see in football players, for example, but there is no real specific treatment. So thank you for your attention. At the appropriate time, I'll be happy to answer any questions you might have. Thank you.